Basically what a veneer is, it can be anything from 0.5 millimeter to 1 millimeter facing that goes over the tooth, and it's very similar to somebody having a false nail. You get two different kinds of veneers. You can get either what we call a composite veneer. Composite veneer is basically white filling material. Or you can get another option is a porcelain veneer. Depending on the patient's individual requirements and affordability factors, we can do either composite or porcelain. Each has its advantages and disadvantages, and what veneers do is it can actually take from somebody who has unsightly teeth, for somebody who doesn't want to smile, does this, to creating a very, very pleasant outcome with minimal, or let's rather say, hardly any damage or hardly any tooth taken away. And in terms of veneers, some people have really, really crooked teeth, and they are quite challenging to do veneers, because if we want to straighten them with veneers, we have to take a lot of natural tooth away. But that's where things like Invisalign or invisible braces play their parts. So what we do is we do some invisible braces, and we straighten the teeth, we get them much straighter, and then we can do minimally invasive veneers. And that's my philosophy, and the current trend towards any modern day dentist is to do what we call green dentistry. What we're trying to do is save the environment. And when I talk about saving the environment, I'm talking about saving tooth structure. The less tooth we have to take away, the better. And in some cases, veneers, we don't have to take any tooth away. There's a term called prepless veneers, where all we do is just take an impression, and we can actually get the ceramist to make a porcelain veneer and bond it on, or alternatively we can just do a composite veneer and actually just shape it and bond it and color it directly on the tooth, which is a very, very nice way of improving somebody's smile without damaging their teeth. Veneers are also very good for people who have either had a small chip in their front tooth. It's a very conservative way of restoring the shape of the tooth. And veneers are also very, very good for people who have little spaces between their front teeth and don't want to do orthodontics. So basically we just widen, the veneer just widens the outside surface of the tooth, and that way it can create a nice, pleasant, harmonious smile.